Okay, so this I divided this this abdomen into 9. You see, like this. So we have number 1, 2, 3, 4, 5, 6, 7, 8, 9. And people will always tell you that they are having pain. All of these division, the segments, they have their different names. But because I'm not teaching medical students, I'm not going to be mentioning the names, but I will describe what happens at this particular segment I want to talk on now, which is here. People will come and tell you that they are having pain here. Most times the pain will radiate to their back, somewhere here. They will start feeling pain, and now they will start taking medications for cold. They will tell you they have cold. What do we usually have here? This is called the epigastric region, and this is where your esophagus starts going down to the left. That is this number 3 at the left side. That is where your stomach is located. Pain can come at the epigastric region when you are having peptic ulcer, when you are having malaria, when you are having any cardiac disease. But when that pain continues from here and then radiates to the back, that is a peptic ulcer disease. It will give you that pain. So when you take your pain relieving medications, please know the exact one you are taking, because in the process of trying to relieve yourself from that pain, you may be giving yourself more pain, because it's not going to relieve, rather the pain will become worse. So how does peptic ulcer happen? It is just the erosion. Let us say my skin, my hand is covered with skin, and now something happened and I had bruises here. This skin is removed and you are seeing the inside part of that skin. Let us take, for instance, hot water poured on my hand and the skin peeled off. When the skin peels off, if water touches that part, I'm going to feel pain. If my hand or my finger touches that part, I'm going to feel pain. If anything comes in contact with this heart, I am going to feel pain. The same thing is applicable to your stomach, that when the lining of that stomach wall is being eroded by excessive production of hydrochloric acid, you are going to start feeling pain. When you eat food, you will feel pain. But sometimes when you are hungry, when you have not eaten food, that pain will come. When you eat food, the pain will subside. That is why we have 2 types of ulcer. Not allow anybody to deceive you. Ulcer is just of 2 types. The one that will come with pain when you have eaten, and the one that will give you pain when you have not eaten. So for the course of this, I am going to talk about the difference between the 2 types of ulcer. One is called the gastric ulcer. One is called the gastric ulcer and one is called the duodenal ulcer. So how will you know when you are having gastric and duodenal ulcer? After now, I am going to explain the causes, the symptoms, and the types of ulcer we have, though I am into the types now. Now, when you come to gastric ulcer, we have the symptoms you are going to present with. I am saying this so you can know when you are having pain, any symptom you are having, you can say, oh, this is the type of ulcer I am having. Remember, ulcer happens in your stomach, and your stomach is located at the right side, just below this your breast, the right side, the left side. That is where ulcer is located, and the pain is usually at the epigastric, radiating to the back. That is where you feel the pain. So how will you know? How will you differentiate gastric and duodenal ulcer? In gastric ulcer patients, they feel the pain half hours after the intake of food. Yes, once they have taken coarse food, half hour the pain will start. Half hour the pain will start. But in duodenal ulcer, they will feel that pain 2 to 3.5 hours after they have finished eating food. Once food enters their stomach, 2 to 3.5 hours, that pain will set in. That is how you will know I am having gastric ulcer and I'm having duodenal ulcer. In gastric ulcer, I repeat, half hour after the intake of food. But in duodenal ulcer, you feel the pain 2 to 3.5 hours after the intake of food. Do you notice the difference now? Okay, now the pain is felt half hour because I have explained that in this my hand now, If it peels off, anything that comes in contact with this will start paining me. The same thing is applicable in your stomach. So now you have taken in food, mastication will take place, it will go down, the process of digestion will start depending on the type of food you just ate. Once the food or whatever content you have eaten comes in contact with your stomach, it will create that pain. But in duodenal ulcer, 2 to 3.5 hours after ingestion of food, there is digestion already and your stomach will become empty. Now, that hydrochloric acid in your stomach will now start coming in contact with your stomach lining, and that will give you pain. That is in duodenal ulcer. Another difference you will note in you have gastric ulcer is intake of food does not relieve the pain. If you are having that pain, you say maybe it is because I'm not, let me go and eat. Once you eat, the pain will become worse. So intake of food will not relieve the pain. But in duodenal ulcer, when they eat food, the pain will subside. Once the food digests, 2 to 3.5 hours, they will start feeling the pain. And that's why we see that in duodenal ulcer, because they tend to be eating more often, they used to grow fat. Yes, they will be adding weight because it is called bulimia. They will be eating so they will not have pain. But in gastric ulcer, they are scared of eating because once they eat, the pain will start half hour following the ingestion of food. So they will be scared of eating. They won't like to eat to avoid the pain, and that will make them to start losing their weight. That is the difference between duodenal and the gastric ulcer. Then another difference, the symptom you will see in gastric ulcer is the quick onset of epigastric pain in gastric ulcer patients makes the patient to lose appetite. This is just what I have explained. They will lose appetite, they are scared, they don't want to eat, and that will make them to start losing weight. Then in gastric ulcer again, we see it in people of 50 years and above. But it is very unfortunate that these days, even small children are having gastric ulcer due to the ingestion of medications. Everybody wants to be free from pain, and now they will be taking medications. Young boys are into drugs, doing one thing or the other, and that is exposing them to this ulcer. Some people, because of hardship, they will not even take care of themselves. They can't even afford the food, and you see them having this ulcer. So gastric ulcer, 50 years and above, the ulcer will set in. But in duodenal ulcer, less than 50, from 30 to 60 years, you will see they will start having ulcer. 20 years old boy or girl will come and tell you that they are having epigastric pain and pain at their back. So these are the most symptoms you will see. You will say this person is having duodenal ulcer and this one is having gastric ulcer. So it's not left for you to tell yourself, oh, this pain I'm having, it usually comes immediately after food. Immediately after food, I'll start having pain. Oh, it's gastric ulcer. And then, 2 hours, once my digestion takes place, I will start having pain. That means you have duodenal ulcer. Then, in gastric ulcer again, another thing you will note is that it is in the same ratio in male and female. It is in the same ratio in male and female. If we have 50 male and 50 female, both of them can suffer ulcer. But in duodenal ulcer, the ratio is 2 to 3:1. Yes, it is most common in male than females. In duodenal ulcer, it is most common in male than in female, with ratio of 2 to 3:1. What I'm saying is, if we have like 10 people here, 5 male, 5 females, you will get this duodenal ulcer in 7 male against 3 females. That is 2 to 3:1. It is not a 50-50 something. In gastric ulcer again, bleeding is likely to occur. Bleeding is likely to occur when you are having gastric ulcer. Is either you are passing out stool that is mixed with blood, or you are vomiting blood. But in gastric ulcer mainly, the blood that will come is vomiting. You will vomit blood. So you don't say because this person is vomiting blood, they have given this person poison, they have done this one or the other one. No, The first thing is gastric ulcer. Are you having a gastric ulcer? That is when you start, coughing out or vomiting blood. But in duodenal ulcer, you stool out blood. Your stool will contain blood. Then you will know that you are having a duodenal ulcer. Do you understand? Gastric ulcer, most common, is in association with cancer. That's why you should find out the type of ulcer you are having, so you will start on time to do the necessary investigations, so you will not run into malignancy. Yes, when you have malignancy, it means you have cancer. So cancer is common with gastric ulcer rather than in duodenal ulcer. Then another symptom you will see in gastric ulcer, in this ulcer, is risk factor of gastritis. If you are having gastritis already, if you are the type that drinks alcohol, if you are the type that smokes, you use NSAID, stress and every other thing, you are quick to anger, you have stress, these are the things that will predispose you to gastric ulcer. Unlike in duodenal ulcer, it's only alcohol, stress, smoking and liver diseases that those people will have duodenal ulcer. Do you understand? All right. Then in gastric ulcer again, how you will know you have gastric ulcer? There is hyposecretion of the stomach acid. That is reduced secretion of the stomach acid. You understand? This hydrochloric acid comes in a little quantity, and that will make your stomach to be coming in contact with your your stomach lining, stomach wall, and that will cause ulceration, that will cause erosion of that stomach wall. You understand? Now, when you come to duodenal ulcer, the HCl is in excess. That's, we have hypersecretion of this hydrochloric acid, and when it is hypersecreted, it's still going to leave your stomach with churnings. It's going to chop off the walls of your stomach. It's just like when you pour acid on your skin. What will happen? It's going to chop off your skin. That is in duodenal ulcer. Another sign you will see, you will know that you have gastric ulcer, is weight loss. I have said it time without number that weight loss occurs in gastric ulcer because they are scared, because of the kind of pain they have. They are scared. They don't want to eat food, because once food sets in, once they taste anything, once food comes in contact with their stomach, they will start having pain. Thereby they will run away from food. Once they see food, they will feel very uncomfortable, and that will make them to start leaning. Yes, they will start reducing weight. Unlike people with duodenal ulcer, in duodenal ulcer, they will like to eat and eat, so they will not even have space to feel pain. These are the differences you will note. So you will know when you have peptic ulcer, gastric ulcer, and when you are having duodenal ulcer. And now another person asked, what are the causes of this ulcer? Sometimes people will tell you that, hey, ulcer don't have cause, so it's because some people will say because they are eating peppery food, that's why you have ulcer. Let us continue in the next video on the causes of peptic ulcer. Please do well to follow my YouTube handle and TikTok. I love you all. See you.